Hey everybody, it's Monday. I wanted to just talk a little bit. I haven't had a live video for a while now, and given everything that's been going on, I intentionally sort of took a break. I know that I felt or have been feeling somewhat paralyzed with regards to publicly sharing my perspective, being, on what is going on, just given the fact that as a white woman, that brings with it a lot of privilege that minority populations just don't have. I can walk down the street without apprehension. I can, doors open for me. I don't have to worry about that. So why would I speak to this problem of, racism and systemic racism? And it's certainly uncomfortable to weigh in as a beneficiary of the systemic racism that's been going on. And so I've realized that my job is more to listen than to talk. So I've been certainly watching a lot of documentaries, shows, reading about it, talking to my friends in the Black community and leaders that I find some are on this. I know Dr. Vanessa Evans is one hero of mine who's in this group. But I've been really doing a lot more research, specifically as it pertains to systemic racism and health disparities and food racism. So that's what I wanted to talk about today, and that's why I wanted to come on live today. So it's about a system that's really set up to fail Black and brown people. It just is. There's so much long-standing data that shows that the darker your skin is, the poorer health outcomes you have, and the lower those that have less socioeconomic resources have poorer health outcomes. And so I have a few stats I just wanted to share just to bring it to light. And so one of the things is that, again, the darker your skin is, the less access you have to secure housing and food and education and transportation. And looking at COVID specifically, the Black people are much more vulnerable. Again, they have less access to care, insurance, and they oftentimes have health conditions, chronic health conditions that lead to more severe complications. And Black people tend to work in occupations that are higher risk. They're in the service industry, they're bus drivers, they're postal workers, food service workers, that they can't social distance. They can't take the time off. They have to go to work. I was looking up a couple other stats. Black children suffering from appendicitis are less likely to get pain medication. Black children have a 500% higher death rate from asthma. This is something I treat in my clinic every single day. But they're 500% more likely than white children to die of asthma. Black mothers are 3 times more likely to die in childbirth than their white counterparts, and Black babies, infants, are more likely to die, 2 times more likely to die. And men specifically Black men have the lowest life expectancy of any population. In Chicagoland area, Streeterville is an affluent suburb or affluent part of Chicago. The life expectancy is 90 years old. Just 9 miles south in Englewood, the life expectancy is 60. So all of those things really just, I think, show that it's a problem, and it's been a problem for a long time. Okay, and so what do we do, right? I think. We don't often talk about it because we oftentimes don't know what to do. We don't know how to solve it. So we don't even bring it to light, right? And so I think it's all of our jobs to work on it. One of the things I think about is food deserts, specifically as it pertains to health and wellness. And a food desert is defined as an area in the U.S. that has less access to nutritious food and like grocery stores, for example. It's defined as living in an urban area, living more than 1 mile from a grocery store, and in a rural area, more than 10 miles from a grocery store. And in urban areas, it's usually in the low income areas. And they're oftentimes people in this community will opt to go to the convenience store or a fast food restaurant because they can't or don't want to pay $5 to $7 each way, right, on a bus trip to go to the grocery store. So this is a problem, right? This is something we need to focus on. We have to design interventions that are going to serve the most vulnerable, and then everyone will benefit, everyone will win, right? And I think on a personal note, my pledge is to call out when I see racism. I'm going to certainly bring to light my own implicit biases. Of course I have those, and and then there's quizzes you can take. I took one the other day on Instagram about my own implicit biases, and now you have it for sure. And so I need to work on improving these in my work, in my social life, all of that, and help try to solve the problem. That's one of my other pledges, is to help solve the problem of health disparities. And I know, in being in the plant-based community, sometimes there's the sense that to be plant-based or vegan, it's something that requires you going to Whole Foods and really buying expensive food, and that it's a privilege. And we need to, as plant-based leaders, eliminate that, because it's actually so affordable. We know that, right? And it can be very affordable, and it is. It's just something we need to make sure we're sharing and going into the communities and sharing. The good news is, Black people are actually the highest, the demographic with the highest rate of going vegan or vegetarian, which is great. 8% are, and it's a lot of young Black people that are becoming vegan and vegetarian. And so I pledge to do my part and try to provide some education, like I am here, but more so even in Black and brown communities surrounding healthy eating. So anyway, I just wanted to come on and just share some of my thoughts on it. And again, even knowing that my job is more so to listen versus talk about it. I need to listen and then do my part, as we all do. So I hope everybody's having a good Monday, and we'll see you soon.